We'll take you now to the Acting Premier.
Morning all. Right to go? Okay, thanks everyone. Thanks for coming along this morning. I've got a bit to do, so bear with me, and then I'll hand over to the Minister for Health, and Professor Sutton is here as well, and we'll answer all your questions. So there are 34 active cases of coronavirus in Victoria. A remarkable 40,411 people got tested yesterday, the most ever processed. So my thanks to everyone. I know there was a level of inconvenience with those magnificent numbers, but I do thank everyone for getting tested. And we had 12,677 people getting vaccinated, another extraordinary number, and my thanks to everyone who are hearing the call. The best thing we can do is to get vaccinated when we're eligible. We said this time yesterday that the next 24 hours were going to be particularly critical in terms of what our next steps will be to ensure that we keep our state safe. In the last day, we've seen 12 linked new cases, bringing the total number of cases linked to the hotel quarantine breach in South Australia to 26. Sadly, we have one of those people in an ICU on a ventilator in not a very good way. In the last day, we've seen more evidence that we're dealing with a highly infectious strain of the virus, a variant of concern which is running faster than we have ever recorded. As of first thing this morning, we've identified in excess of from first thing this morning, we've identified in excess of 10,000 primary and secondary contacts who will need to either quarantine or test and isolate, and that number will continue to grow and change. Our public health experts' primary concern is just how fast this variant is moving. And we've seen overseas how difficult that movement can be to control. Here in Victoria, we're seeing not only how quick it is, but how contagious it is as well. Our contact tracers are identifying and locking down the first ring, second ring and third ring within 24 hours. They've never done that before. That is the fastest our contact tracers have ever moved, within a 24-hour period, identifying and locking down first, second and third rings of cases. But despite working as fast as this, and my thanks to all of our contact tracers, this variant is moving faster still. The time between catching the virus and passing it on is tighter than ever. So for some of those cases that I've mentioned, for some of them, the serial interval, that is how long it takes between the onset of symptoms in the first and secondary case, is averaging just over a day. Now, to put that in some perspective, the usual transmission is about 5 to 6 days. In some of these cases, within a day, it's being transmitted. And in just 24 hours, the number of cases has doubled. So unless something drastic happens, this will become increasingly uncontrollable. We also know our nation's vaccine rollout has been slower than we hoped. That is a fact. The vaccine rollout is not where we hoped it would be. It's not where it should be. And if more people were vaccinated, we might be facing a very different set of circumstances than we are today, but sadly, we are not. If we make the wrong choice now, if we wait too long, this thing will get away from us. And that's what we've been talking about for the last few days. And when we were here before you all yesterday, that 24-hour period was just so critical. And with 10,000 primary and secondary contacts, cases, with more than 150 exposure sites right around the state of Victoria, we've got to act now, and that is the clear expert advice from our public health team. So I'll take you through the changes that will be implemented. From 11:59 p.m. tonight, Victoria will enter a 7-day circuit breaker lockdown, and these restrictions will be in place until 11:59 on Thursday, the 3rd of June. If we can ease those restrictions earlier, we will, but this is a 7-day circuit breaker lockdown. So from 11:59 tonight, there are 5 reasons to leave home, not 4. Shopping for necessary goods and services, authorised work or permitted education, exercise, a 2-hour limit with one other person, caregiving, compassionate and medical reasons. So they're the existing 4 that we know and understand from previous circuit breaker lockdowns. There is a 5th reason why you can leave your home, and that is to get vaccinated. I can't stress this enough. The only pathway through this pandemic is for people to get vaccinated as soon as they are eligible, and for our state and our nation to have an alternative to quarantine in terms of high risk. For shopping and exercise, you need to stay within 5 kilometres of your house, unless your nearest shops are further away than that. Masks must be worn everywhere, indoors and outdoors, anywhere other than your home, unless an exemption applies. There are to be no visitors to your home other than an intimate partner. But single bubbles will be permitted. If you live alone, you can make a bubble with another person. And there are to be no public gatherings. In terms of what remains open, so restaurants, pubs and cafes can provide takeaway only. Essential retail, so supermarkets, food stores, petrol stations, banks, bottle shops and pharmacies. Other retail stores can provide click and collect. Childcare and kinders will be open as per the last circuit breaker lockdown earlier this year. Approved professional sporting events will proceed, but proceed without crowds. Authorised workers and workplaces. In terms of what will be closed or changed, schools will move to remote learning except for vulnerable children and children of authorised workers. Higher education will move to remote learning only. Community sport and recreation. Accommodation, but there will be some exemptions that apply. Hotels, clubs, tabs and the casino will be closed. Indoor and outdoor entertainment venues, swimming pools, spas, saunas, indoor and outdoor springs. Community venues like libraries, toy libraries, but click and collect is permitted. Hairdressing, beauty care and personal services. Drive-in cinemas, amusement parks and arcades. Creative studios, art galleries and museums. Tourism, tours and transport. And auctions can only happen online. In terms of our health settings, aged care facilities, no visitors except for very limited reasons. And in our hospitals, visitors only for end of life, to support a partner during birth or a parent accompanying a child. In terms of ceremonies, funerals, a maximum of 10 people plus those running the service. Weddings cannot proceed unless end of life or deportation reasons apply. And religious activities will not proceed other than through broadcast with a maximum of 5 people. So before I hand over to Martin to take us through some further detail in terms of vaccines and testing, the other thing that I indicated throughout this week is that we were looking at how we can expand the eligibility for vaccinations. And we've been doing that work, and we've got advice from Public Health and from the Department of Health more broadly. And I can announce that from tomorrow morning, vaccinations at state sites will be expanded to include those in the 40 to 49-year-old age group for the Pfizer vaccine. So that means now, in our state sites, if you are over 40, you are eligible for a vaccine. So we need you to call the hotline. We need you to make a booking. In terms of GPs, that will be a decision of the Commonwealth, but in terms of the state sites that we run, we'll be expanding it to 40 to 49. So I really encourage everyone, if you are eligible, get vaccinated. The reason why we are dealing with this outbreak today is because of a hotel breach in South Australia. That is not a criticism, it is just a fact. We've had breaches in hotel quarantine right around our country. The only way through this pandemic is everyone getting vaccinated as quickly as you are eligible, and for the Commonwealth to agree to an alternative quarantine arrangement, particularly for high-risk individuals. And in this case, we're talking about a variant of concern. If we had an alternative to hotel, for this particular variant of concern, we would not be here today. If we had the Commonwealth's vaccine program effectively rolled out, we may well not be here today talking about these circuit breaker restrictions that we must impose to keep our community safe.